Welcome back to the Center for Sexual Health and Education. Today we're going to talk about urinary leaking. I get a fair amount of questions regarding squirting versus female ejaculation versus just plain old leaking. And the fact is that there are very few experts in the sexual health field that believe that women can ejaculate a half of a cup or some volume that we're led to believe is occurring. Most of us believe that that is urinary leaking. Now, that said, most of the time it's clear, diluted, odorless, and the partner generally doesn't know that that is urine. In fact, they are led to believe that they've just stimulated their partner appropriately and that she ejaculated an enormous amount. So I'm not sure that it's necessary to share the problem of leaking with the partner, but nonetheless, for women, there are things that you can do. Stress incontinence or urinary incontinence is caused by a change in the anatomy that's most often occurring after childbirth, vaginal birth. And over the years, as the muscles get weaker and the tissue gets weaker, there's more mobility in the urethra and bladder area, and stress incontinence can occur. That occurs when you cough, laugh, jump, bend over, jog, or have an orgasm. There are several procedures that can be done by your gynecologist, a urologist, or a urogynecologist, and many of them are done as an outpatient. They're called sling procedures, and they're done through the vagina. Many doctors do the procedure without any kind of incisions on the skin. On occasion, you'll be counseled that you may have to wear a catheter for a few days after the procedure because the repair tightens you up so nicely that sometimes it takes a few days for that area to relax. For those of you who are not interested in surgical management, some medical management that may help stress incontinence includes weight loss. Obesity is one of the #1 causes of stress incontinence. It has been shown to occur even in women who have never had any children vaginally. So simple weight loss, which is a good, healthy thing for any recommendation, also helps reduce the amount of urinary leaking. For those of you who are concerned about your leaking on a date, hydrate well so that your urine is clear. No B-complex vitamins, as they will turn your urine a bright yellow, which might be for an embarrassing moment with orgasm. And simply see how things go from there. But stress urinary incontinence is the problem. There is a surgical fix. There's some behavior problems. And most of the time, your partner has no idea that that's what's going on. They're more happy to consider that they're just really stimulating you well and turning you on. So we'll leave it at that. And that information is brought to you today by Dr. Maureen Whalehan from the Center for Sexual Health and Education, www.bestsexualadvice.com, and that's 888-LOW-DESIRE. Have a good day.